Hello everyone, welcome to Nursing Officer Outlet. Myself Sachin Kumar Yube, and today I am going to discuss memory based MCQs of the today's NORCET. Here is our first question. First question is like streptomycin primarily affects which cranial nerve? Option first olfactory nerve, option second optic nerve, option third trigeminal nerve, option four vestibulocochlear nerve. The answer is the vestibulocochlear nerve. And here is the same question provided by the Nursing Officer Outlet test series. See here, streptomycin primarily affects which cranial nerve? See here, already they are given vestibulocochlear nerve. Vestibulocochlear nerve is the right answer. We will move to next question. Next question is like a patient is diagnosed with pleural effusion. What percussion note is most likely heard over the affected area? Resonant, hyperresonant, dull, and tympanic. The right answer is the dull sound. Right answer is the dull sound. Here is the same question provided by the Nursing Officer Outlet test series. See here, dull is the right answer. We will move to next question. Third question is a 7-year-old admitted with dehydration develops creatinine 3.1, decreased urine output of 0.28 ml per kg per hour for last 24 hours according to the rifle criteria. This rifle criteria is the new question for everyone, but in Nursing Officer Outlet test series they are already given in their test series in nephrology topic test. You can go and see here. For this they are already given urine output is 0.28 ml per kg per hour. If less than 0.3 ml per kg per hour, then it is known as failure. Here is C is the correct option, and C here they are already given rationale here. According to the first thing is rifle criteria is used to assess the severity of oliguria. See here, according to the rifle criteria, risk urine output less than 0.5 ml per kg per hour for 8 hours, then it is known as risk. Injury means urine output less than 0.5 ml per kg per hour for 16 hours, then it is known as injury. Failure, urine output less than 0.3 ml per kg per hour for last 24 hours, then it is known as failure. Failure is also known as anuria for last 12 hours, then it is also known as failure. Loss means persistent renal failure for more than 4 weeks, then it is known as loss. End stage, persistent renal failure for more than 3 months, then it is known as end stage. See here, option C is the right answer. We'll go to next question. A 9-month-old child has no visible BCG scar, although there is documented evidence that the baby is received BCG at birth. What should be the next step? First option is reassurance of mother and don't do the revaccination. Second option is give BCG immediately. C option is do ICGR test, and fourth option is do Montax test. See here, already baby received BCG vaccination, then no need to revaccinate. Option A is the right answer, and here is the same question given by the Nursing Officer Outlet test series. See here, do not repeat BCG simply because scar is absent. No need to do revaccinate if scar is absent. So option A is the right answer. We'll go to next question. What is the correct technique for positioning the pinna when administering ear drops to 2-year-old child? For 2-year-old child, backward and downward technique we are using for administration of the ear drops. See here, we are already given in our test series what is the correct technique for positioning the pinna when administering the ear drops to 2-year-old child. See here, backward and downward technique we have to use for administration of ear drops in 2-year-old children. So option B is the right answer. We will move to next question. A 16-year-old patient with known type 1 diabetes mellitus presents to the emergency department with complaints of polyuria, polydipsia, vomiting, and abdominal pain. His blood glucose level is 520 mg per dl. He appears dehydrated and has deep rapid breathing. What is the priority action in this condition? See here. First thing is DKA. Here they asked a question about DKA. First priority is D means dehydration. First we resolve dehydration. So we have to give IV fluids. IV fluids. Second K. K means kill the glucose. Kill the glucose by insulin. Second priority is we have to give insulin. And third priority is we have to correct acidosis. So see here, administer the IV insulin immediately. So it is the second priority. It is wrong answer. And start rapid IV fluid resuscitation with normal saline. This is the right answer because here second option, first priority is we have to resolve first dehydration. So we have to start IV normal saline first. Give oral hypoglycemic agents because here already DK is there. If we are giving hypoglycemic agents also, it is not effect. So option B is the right answer. See here, this is a question given in our test series, nursing officer outlet. A 10-year-old girl presents to the emergency department with altered sensorium, deep breathing, vomiting, and severe dehydration, which is first and most crucial step in her management. See here also we given immediate. Here also we given immediate intravenous normal saline bolus. We will move to next question. During an infected wound dressing, nurse notices that sterile drape has fallen below the edge of the table and accidentally touches it to maintain sterility. What is the appropriate action? If anything is fallen behind the sterility means it is unsterile. So replace the contaminated drape with a sterile one. It is the right answer. Here see here, we are already given this question in our test series. While changing the dressing, the nurse touches the sterile field accidentally. Next step is abort and prepare the new sterile field. We will move to next question. A 26-year-old primigravida at 28 weeks of gestation presents to the antenatal clinic with complaints of burning sensation in the chest. Which of the following is the most appropriate reason for this symptom? See here, first option is restrict daily fluid intake, and the second option is increased gastric acid secretion during the pregnancy, enlarged uterus pushing abdominal organs upward, increased progesterone levels causing the relaxation of the lower esophageal sphincter. See here, in pregnancy, progesterone causes smooth muscle relaxation. Smooth muscle relaxation and esophageal sphincter also smooth muscle. It relaxes and causes the heartburn in the pregnant. See here is the same question we are given in our test series. See here, in rational, best advice in pregnancy heartburn, decrease in the lower esophageal sphincter tone due to progesterone. We will go to next question. During surgical procedure, the nurse initiate a timeout before the incision. What is the primary purpose of this timeout? To ensure all surgical instruments are sterile, to confirm correct patient procedure and surgical site, to allow the anesthesia to take full effect, to prepare the Operating room equipment. Answer B is the right answer. See here. Here is a question given in nursing officer outlet test series. According to the WHO surgical safety checklist, which step is performed immediately before skin insertion in the operating theatre? Timeout is the right answer. Here is a whole checklist, WHO checklist already given. Once you go through this test series, sign in when we have to do sign in before anesthesia, and time out before skin insertion, and sign out before patient leaves from the OT. We will move to next question. A 22-year-old primary gravida at 10 weeks of gestation presents with paravaginal bleeding and excessive nausea. On examination, the uterus is larger than expected for gestational age. Which of the following is most specific characteristics of future of a molar pregnancy? Molar pregnancy. Everyone knows grape-like vesicle, grape-like vesicles with vaginal bleeding is the most specific feature for the molar pregnancy. Molar pregnancy. So here is the right answer D. See here, in nursing officer outlet test series, we given a 25-year-old G1 P0 at 11 weeks of gestation presents with the vaginal bleeding and passage of grape-like vesicles. Examination reveals uterus larger than dates. In USG shows heterogeneous echogenic intrauterine mass with classic snowstorm appearance, absent fetal pole, heartbeat, and thin myometrium serum. Beta SCG is 2.5 lakh milli international unit per ml. The answer is complete mole. Everyone knows grape-like vesicles seen in molar pregnancy. We'll move to next question. A patient with schizophrenia tells the nurse there is a mention of me in a today's news TV channel. This is a symptom is used most effective of. It is a symptom of thought, not thought insertion. It is not a thought broadcasting. It is a delusion of reference. So here, see here is the same question given in nursing officer outlet test series also. We'll go to next question. Sinusoidal wave pattern in CTG occurs due to. It is due to fetal anemia. Here in nursing officer outlet test series also they are already given CTG graph, and here sinusoidal pattern, fetal anemia, immediate management also they are already given. Immediate transfusion or delivery is the management, and the sinusoidal, if sinusoidal pattern is there means then it is due to fetal anemia. We will go to next question. A 25-year-old woman with 8 weeks of amenorrhea presents with sudden severe abdominal pain and dizziness. She had a brief loss of consciousness on the way to hospital. She also complains of shoulder tip pain. See, shoulder tip pain and an urge to defecate. On examination, she is pale, tachycardic, and hypotensive. What is the most likely diagnosis? See here, 8 weeks of amenorrhea is there, and severe lower abdominal pain is there, dizziness is there, and moreover shoulder tip pain is there. Shoulder tip pain also known as care sign. Shoulder tip pain also known as care sign. Care sign. This care sign seen in ectopic pregnancy. Option B is the right answer. Ruptured Ectopic pregnancy with intraperitoneal hemorrhage is the right answer. See here. Here is the same question given in nursing officer outlet test series also. Option B is the right answer. Ruptured ectopic pregnancy is the right answer. We'll move to next question. A 16-year-old girl is brought to the clinic due to frequent mood swings, impulsive behavior, and intense emotional reactions. She reports persistent fear that people close to her will abandon her, leading to unstable friendships and relationships. What is the most likely diagnosis? For this, answer is borderline personality disorder. Here is the same question given in nursing officer outlet test series. See here, they are given borderline personality disorder in question and this symptom in rational. Brief rational also given in this question. Classical feature of borderline personality disorder includes fear of abandonment, splitting, impulsivity, and self-harm and emotional instability. We will move to next question. This is a telemanus question. The telephone number for 24 into 7 telecommunication mental health counseling service is associated with which national government service? For this, everyone knows the answer. Telemanus is the right answer. Here is the question given in nursing officer outlet test series. See here, given number also associated with the which national government service? It is the telemanus. We will move to next question. What is the standard method to measure NG tube insertion length in adults? Option 1, nose to earlobe to umbilicus, nose to earlobe to gypoid process, nose to sternal notch, and fourth option is bridge of the nose to midpoint of the clavicle. And second option is the right answer, nose to earlobe to gypoid process. See here is the same question given in nursing officer outlet test series. What is the standard method to measure NG tube insertion length in adults? Nose to earlobe to gypoid process. It is the right answer. A 5-year-old man with long history of alcohol dependence presents 3 days after stopping alcohol. He restless, disoriented, and reports seeing small animals moving on the walls. Which of the following characteristics a future of delirium tremens? Option A is the bradycardia and hypotension. Second option is the visual hallucination. And third option is the autonomic hyperactivity. Third option is the hypotension, course, tremors, bradycardia. And second option is the visual hallucination, autonomic hyperactivity. And the fourth option is the pinpoint pupil and respiratory depression. For this question, answer is the B. Right answer, visual hallucination with autonomic hyperactivity is the right answer. And see here, a patient with stopped alcohol consumption for 3 days and presented with irritability, disorientation, paranoid delusions, agitations, visual hallucinations, and altered sensory. What is the likely diagnosis in this case? Delirium tremens. See here, visual hallucination, they are already given in question. Visual hallucination seen in delirium tremens. We will move to next question. During administration of the blood transfusion, as per protocol, which of the following nursing action is the correct? Except verify the patient identify and blood compatibility with another healthcare professional. Yes, this is the right answer. And the second one is ringer lactate is commonly used for blood transfusion. It is the wrong answer because if we given RL with blood, it causes clot formation. So that's why we have to avoid ringer lactate is commonly used after blood transfusion. So we have to avoid ringer lactate with blood transfusion. Here is the right answer is ringer lactate. We'll move to next question. A child less than 2 years of age has diarrhea but no signs of dehydration. How much ORS should be given after each water stool? Answer C is the right answer. After each water stool, we have to give 100 to 200. Sorry, for this answer is 50 to 100 ml. After each water stool, we have to give 50 to 100 ml per stool. Per stool. We'll go to next question. A patient presents with a BP 80/60, heart rate is 120 per minute, and increased hematocrit. This is a clinical uh, picture most likely indicates which of the following conditions. And the first option is fluid overload. Second option is fluid resuscitation, inadequate fluid resuscitation, volume deficit. See here, BP is less than cutoff. So, inadequate fluid resuscitation is the right answer. Next question is a 24-year-old primigravida is second stage of labor. The fetal head is crowning and the nurse midwife applies the uncontrolled upward pressure from the perineum while supporting the fetal head to prevent perineal tear and allow gradual extension of the head. Which maneuver is being performed in this situation? For this answer is a reticence maneuver need to do. See here is the same. Here is a question given in nursing officer outlet test series. Which of the following maneuvers commonly used to assist the delivery of the fetal head during the normal labor? Here they ask for gradual extension of the head. So the answer is reticence maneuver. See here. In rational also they are already given. Reticence maneuvers is specifically used during the normal vaginal delivery to control and assist the delivery of the fetal head. We will move to next question. What is most likely consequences of the using CPAP machine without an expiratory valve? For this answer is increased CO2. We'll move to next question. Which of the following parameters primarily measured using device shown in the image? This is the image used to assess the EtCO2. It is a sensor used to assess the EtCO2, and for this answer B is the right answer. Partial pressure of the carbon dioxide at end expiration. See here. Here is the same question given by the nursing officer outlet test series. A sensor cable is shown in the image which connects to the multi-parameter monitor and clips in line with patient's airway circuit to measure exhaled carbon dioxide continuously. What is this device? This device is end tidal CO2 sensor. Okay. We will move to next question. What is the name of the national parliament of the Japan? For this answer is C. Diet is the right answer. Identify the word that responsible in meaning to amiable. For this answer is A. Hostile. A woman with preeclampsia. So a woman with eclampsia is receiving MGSF4 infusion. Which of the following findings indicates magnesium sulfate toxicity? First option is deep tendon reflexes, and second option is respiratory rate more than 17 per minute. Third option is urine output 20 ml per hour. For this option C is the right answer. Red flags for the MGSO4 toxicity is urine output less than 30 ml per hour and respiratory rate less than 17 per minute and loss of deep tendon reflex. Then these three are red flags for the MGSO4 toxicity. We'll move to next question. Headquarters of the National Institute of Oceanography is located in which Indian city? For this answer is Panaji. We will move to next question. A patient receiving TPN via central line has infusion abruptly stopped due to a pump malfunction. Which of the following complication is the most likely to occur? For this answer is hypoglycemia. And here is the same question given in nursing officer outlet test series. For this also answer is hypoglycemia. We will move to next question. A nurse is preparing to administer rectal suppository to an adult patient. What is the ideal depth of insertion beyond the internal anal sphincter? For this, option B is the right answer. 4 inches or 10 centimeter is the right answer. See here is the same question given in nursing officer outlet test series. A nurse is preparing to administer rectal suppository to an adult patient. What is the ideal depth of insertion beyond the internal anal sphincter? They are already given 4 inches. It is the right answer. See here in answer tip also they are given adults 4 inches, for children 2 inches, for infant 1 inches. So here is the right answer. Second one, 4 inches. We will move to next question. Blue revelation in India refers to which of the following? Blue revelation in India refers to which of the following? For this answer is B, fish production. See here in non-nursing content they are already given. The blue revolution in India refers to fish production. This is a question. Which function key is commonly used to refresh, reload a web page in most of the web browser? For this answer, one is right answer. F5 is used to refresh the web page. See here, all question we have discussed. These are all memory based MCQs. This is part 1 only. And very soon we will release part 2 also. And from 16th onwards of this month, in nursing officer outlet test series app, they are giving free mains for everyone. If any query is there means you can contact this number 888-622-515. If any query is there means you can contact this number. They will provide